but I don't do it in a way of getting money because it won't work.
Well, I'm actually in the process of going live to speak with a gentleman named Chris Boyce that was had a brain injury, and he has a group of on Facebook where he he supports people with brain injury, and he actually helped me out with Sanaya
Yes.
when I was able to talk to him. So I'm live right now.
What? You talk to him. You can talk to everybody and anybody like that you want. I encourage that. I think that if you're going to be effective, the way to be effective is to get a group of you mothers that have had this brain death thing done and get organized so that when we get a chance, we'll have those people to speak up. The Uniform Law Commission is going to come back again. They call it on pause, but it's just a matter of time, and they'll come back with another law, another revision that's going to be worse. So the best thing we can do is be prepared for that. Hey, listen, I have to go to physical therapy myself, so I got to stop.
Okay.
Okay?
All right.
You take care.
Thank you.
Bye, Crystal. Bye.
Hi, everybody. My name is Crystal Hughes, and this is today's Focus with Crystal. I'm sorry that I logged in late, but I just got some disturbing news. The topic today is about brain injury. And my little girl, she unfortunately had a near-miss event. And thank God that he taught me years ago about CPR. And so I was able to perform CPR on her, and she started back breathing. When she got to the hospital, they told me she was still breathing, that they got her back breathing, and, basically she'll be fine. So she'll be fine. But the problem is that they wanted to convince me that she was dead when she was clearly alive. Now, the reason why I said that she was alive, because, have you seen anyone heal who was dead? Do the dead heal? If you have, let me know. The dead do not heal. When you're dead, your body starts to decay. It starts to break down so you can go back to the earth from which you came, which you are. So I didn't believe them at all. I said, no, my baby's alive, because you just came in here and told me her liver is doing better, her kidneys is doing better, all her organs are functioning well. And they were so excited, like kids with candy, over her organs doing well. And I said, well, what about her brain? Oh, well, what about it? Excuse me, isn't that why we here? Then you say that because she went without oxygen, she got brain issues. Like, why are you not focusing on her brain? If you go to the doctors, right, and your thumb get cut off, no thumb, why would you be focusing on my 4 fingers? Why would you be focusing on my 4 fingers? That's still attached, and you're not thinking about my thumb. I'm here because my thumb is decapitated. Can you please help my thumb? But you're worried about, her other 4 fingers are fine. Meanwhile, my finger over here throbbing, bleeding, cracking, all kinds of stuff, it's gone. But at the end of the day, you don't even want to focus on my finger. If I go to the doctor and I say I got a headache, okay, I say my head hurts, right? But then they say, oh, well, your stomach. Let's focus on her stomach. Sir, I'm here for a headache, not because my stomach ache. And that's what's happening in the doctors. And that's what I had to experience with my daughter. And I just got some bad news because I thought I'll be able to get some help, but I didn't. But Chris is here to join us, and I'm excited to have him on. Hey, Chris, thank you for your patience.
What's going on? Live from the vehicle.
Live from the vehicle. Hey, you got to go where you got to go. It looks like a nice vehicle on top of that. Is that a Jeep?
That's my wife's baby, not mine.
Hey, I'm a Jeep girl myself.
Yep.
Yes. So Chris, I was actually just speaking with the viewers in reference to the call I just had about my baby girl and trying to get her autopsy revised because they did not address the fact that she had a huge burn mark and a huge peeling of the skin from silver nitrate being ingested. Instead, they want to say that she passed from her brain injury. And basically, they're saying people that have brain injuries cannot have a normal life, cannot survive, won't survive. And that is why I wanted to have you on the show today, because I know you have your challenges, but at the same time, you like you said, you got a wife.
Yeah, she hasn't left me yet.
That's awesome. So tell people why you started your Facebook group, the CT Dementia and Brain Injury Unite on Facebook, and what it's all about.
You know, in 2016, I had to quit my job, and I was kind of, bored at home, and I was searching on Facebook, and I think at the time there was only one other CTE group. Of course, now there's a bunch of them, and I thought, you know what? Why don't I just start my own CTE group and kind of put my own spin on it, because there wasn't really a whole lot of talk about it on Facebook.
So
So
what
that
does CTE stand for?
chronic traumatic encephalopathy.
And that's what your diagnosis is.
Suspected, since there is no way to diagnose you unless you're dead. The closest you can get to a diagnosis of CTE is going to be something called TESS, which is traumatic encephalopathy syndrome. So if you meet a certain criteria, and don't ask me what it is, I don't remember off the top of my head, but if you meet that criteria, then you can be diagnosed for TESS at the moment.
So during your health journey, how I guess difficult or easy has it to have the doctors you know give you a chance? Like, because I know sometimes, like for instance, I talked to a lady, they basically gave her 2 days to live, and then when she didn't die, they was like, die already. You know what I'm saying? So it's like, what push did you get from the doctors, or pushback when you said, okay, I can do this, and they say, oh, you can't do that? Or were you ever told you couldn't do anything that now you're doing?
I've never been told I can't do anything. The biggest problems I see with the medical field, and this is not only just CTE, it's brain injury also. You go there and they want to blame everything on mental health. So, they're going to send you to the psychiatrist, they're going to send you to the therapist, and they're going to be shoving pills down your throat. And it's not going to be until they run out of medications to actually give you. I mean, this is only my experience, but once they run out of medications to give you, and once you've exhausted all other measures, then they look at you, they're like, okay, it's not mental, there's really something going on inside your head.
Right.
So I've been on, I think it's 76 medications. I'm not on any medications now, but yeah, 76 so far. So
Amazing. So now you're not on any. So do you think any of those medications help at all?
no, I'm really sensitive to all the medications. So that was my biggest. When I first got hurt, I think some of the medications helped for a little bit, then they went away. But then I just became overly sensitive. So right now it's just psilocybin, kratom, and kava. That's kind of my cocktail I do at nighttime, because I deal with a lot of sundowning syndrome symptoms at nighttime.
Okay. So how about any alternative medicine? Have you taken anything alternative, like maybe do herbs, juicing, anything special that you do to help with your health regimen?
Those are the only three that I do. So the kratom, which is addictive, so you really got to be careful with that. I don't recommend anybody do that. I'd use it as a last resort. Um, kava's an excellent alcohol replacement. So if you're struggling with drinking, that would be a good alternative. And then psilocybin, if you could get your hands on it. But I mean, I've tried. I was blessed enough to take part in a hyperbarics chamber program here in Florida. So I went through a 60 dives and 12-week program at the Aviv.
Wow.
Yeah, at the Aviv Clinic in Florida. That's pretty badass place. That didn't work out for me. So
It did not. Why? I hear so many great things about the hyperbaric chamber. What
yeah,
your
and
issue?
this place, the founder actually started it in Tel Aviv, Israel. He's like world renowned, and when I was there, I saw people getting better firsthand. So it was really special for me to see that. But I didn't get any kind of improvement at all, and it was like my last day. I was almost in tears, driving home, not feeling any better. So it's just
Wow.
frustrating.
You did the whole entire treatment.
Yep, 12 weeks, 5 days a week. Yep,
Wow. Wow. So
yep,
did you feel any relief? Like, did it make your body feel better, or it just was
nothing,
nothing?
nothing at all.
Same results.
Yep, and I've done photobiomodulation, same results where I hear people are getting great results on that, and my brain just doesn't respond. And
So
I've
what
yeah,
portion, excuse me, what portion of your brain, like I was just reading this article, and this guy, he had 90% of his brain that was damaged. And
damn.
yeah, but he went on to live a normal life. So he did live a normal life now. What
Yeah,
medication on, etc. I don't know, but he went to live a normal life.
yeah, I have an axonal shearing injury, which is not a good one to get. Basically, your wires get cut in the superior frontal lobe. Got two microhemorrhages there, white matter loss. My occipital lobe, I got like low blood flow or something going on there, and I think there's like one or two other spots that some minor stuff I don't remember exactly.
Right, because what I'm hearing is what they're telling me is like, oh well, your baby passed because of her brain. I'm like, no, because she was alive.
Yeah,
She was alive, and then she got silver nitrate poisoning, and then she passed. So why wouldn't you say that it was the silver nitrate that she ingested instead of just putting it on the brain? So do you
yeah.
find like sometimes they put a lot of things on your brain when it could be something else that's wrong?
I feel as far as brain injury goes, again, like I said earlier, they always want to blame it on mental health issues first. They want to label you having depression. They want to, when you tell them you can't pay attention, they're going to automatically assume you have ADHD, you know,
Right, right.
or I don't feel comfortable going out in public. They're going to say, okay, you have anxiety, you know. so it's,
And
so
then
what did so
yeah.
what did I do? I took all those damn ADHD medications because I wanted to prove them wrong, So it's,
So 72 medicines, and your wife been there through all 72?
76.
76. That's a major number. So did you
Yeah,
meet her before or after your brain injury?
she's only known. Well, let me think here. I got injured. No, I think she knew me for like a year before I got brain damage. Yeah, my kids have only known me having a brain injury. So this year will be my 17 years having a brain injury this coming September.
Wow.
So then I think this is going to be our 18th anniversary in October.
Wow.
Yeah, yeah.
So
So I don't know how she puts up with me. It takes like a special person to deal with people like me. So
I'm sure. But even with all of that, you still was able to love, find love, be love, and give love. So that's special,
yeah,
to have
yeah.
that.
'Cause there's no way I'd be able to go out in the dating scene right now. It's just there's no way. It would
Right.
be impossible.
Yes, with all the technology involved in dating.
Yeah, it's just because I can't go anywhere. I can't go in the stores. I can't go to restaurants. I can't go to bars. So it's like, where would I even go for a date?
Right. Yeah, a nice quiet picnic in the backyard sounds like.
Yeah. I don't like being around people, so it'd be real hard. So hopefully my wife doesn't leave me. But
Oh, that's so sweet. So how is it playing with the kids and like raising kids with a brain injury?
it's it's difficult. I mean, they miss out on a lot of stuff. I can't take them to Disney World. I can't watch them in swim practice anymore. I can't watch them during their swim meets. I just can't take them to all those places like a normal dad would because of sensory overload and all that. So they really miss out on childhood.
So when did you get those tattoos, before or after the brain injury?
Both.
How many do you have?
I got this whole sleeve here, then my other like half sleeve, and then one full leg. Yeah, I still got a lot more to go, but I'm broke right now, so I haven't had one in like maybe 4 years, so it's been a while. Yeah.
So do you work at all? Do you actually go to work?
No, I had to quit my job in 2016. So I got hurt in 2007, and I just kept, chugging along until 2016. And then I'm like, I can't do it anymore.
So what kind of job was it more hands-on, or was it like computer or
I worked for the cable company, so I was a business technician for Comcast. So I was going around installing, internet, TV, phone service, and all businesses, and it just started becoming too much for me. I worked for them for I think 16 years. Yeah, long time.
that's a long time. And you had to
Yeah.
keep up. Sound
What
like
was that?
you like what you were doing.
Oh yeah, I loved what I was doing, except for the customers. So,
That's funny. So
yeah,
in your Facebook group, the CTE, dementia and brain injury, what are some things that you guys talk about, or what do you notice what more people are asking for advice about?
it's just really, it's nice to have a place where you can kind of discuss what's going on with yourselves. Because if you're not in any type of support group, you start thinking, is it just me? Am I the only one like this? So when you're in a support group with brain injury or CTE or whatever it is, you start realizing, okay, I'm not the only one dealing with this. And then you start discussing, what stuff you've tried, and you know, come up with ideas, and then people start, trying stuff.
So that's exciting. I'm glad that you have the group, because that's how I reached out. Facebook groups are very helpful, especially when I was going through what I was going through with my daughter, and to be able to go on your page and just read other people's stories and just see what her future might be like. You know what I'm saying? As she healed, it was very promising for me. So I really do appreciate you starting a group and just being active, even though you still have your own challenges, that you still willing to help other people. And so do you ever have any like annual events or anything like that where people can get together and come together? Is anything like that going?
I've thought about it, but then I'm like, you know what? Most of us struggle with sensory overload. We struggle with anger issues. We don't like being around people. So how in the hell are we going to do some annual meetup?
Yeah.
So I was thinking maybe we go do a kayak trip, in Florida or something. But it would just be so, extremely difficult for many of us to, even do it. That's the problem. I mean, speaking for me, there's no way I can do it. I'm sure some people could, but it'd just be too difficult. I don't even like walking out my front door. I mean, right now I'm at a park here, and there's cars around me, and I'm paranoid. So it's not fun being out in public.
Well, you wear it well, and I appreciate
Yeah.
you taking this time, because I had to pull his teeth too. I'm like, come on, Chris, tell the people about your group. You're doing such a great thing. You had to I know you had to put down another one and then start another page, right?
Yeah. Or did I just change the name?
One something, I think, I don't know. I was trying to figure that out, but I know it was a
I
change.
ha- I've changed the name a bunch of times. I've changed the pictures a bunch of times because I get bored. So I get bored real easy. I did have one page that I took down and then took back up. I think the group's been the same the whole time.
Okay. Well, again, I thank you for allowing me to interview you today. This is going to be a short uh interview because, like I said, I have to process the information I just received. And I just did not want to not have the interview because it's important. And you never know who's out there who might be looking for a group for support dealing with their brain injury. So you guys, please check out his Facebook group. If you know somebody suffering from brain injury, or if you are a caregiver and just want to ask questions, they're very friendly in the group. Like I said, I have a baby, and they allowed me to come in the group and talk about my little one. So that's a great thing. So I really appreciate you, Chris, and much love to you and your beautiful wife and your family. And I hope you have better days.
All right, and I'll talk to you tonight, right?
Yes, tonight, and that's over the phone.
All right, have a good one.
Okay, talk to
All
you
right,
later,
bye.
Chris. Hey Siri, set timer for 7:30 for show.